Our study is in the northern Argentina, in a region that is very special because of the geography. It is there is a lot of mountains there, and people are maybe isolated in their houses, and they have a good service of people that work in health. We call them health workers. They go house to house, and they use a system that help us to collect our sample. We collect this sample using the base data of the Ministry of Health of this province, that is Jujuy. All the people that were tested, we for COVID, regardless of the result of the test, we invited them to participate, and there were a lot of people that say yes to this proposal. We have more than 800 participants, 865, and well, there were the majority of them had COVID already. 84% were positive, and we invited people that were over than 60 years old. The thing that this health workers is important because we made a follow-up of these people a year before. Before we tested them initially, and we recorded data about if they had COVID in this year, people that were negative before, if they were positive after that, or if the symptoms, if remain the cognitive symptoms or the clinical symptoms. We recorded all that data, so we know we have data about the permanence, of the smell dysfunction and the cognitive dysfunction 1 year after that. We found what was surprising, I think, was the heterogeneity of the outcomes. Before we found people that after COVID they had no cognitive symptoms. They were totally normal, and or maybe they had a few symptoms, maybe attentional or in executive function, people that had difficulty to make decisions or to pay attention to things for a long time. But well, there were another group that had severe cognitive symptoms with more than their 3 dimensions, cognitive dimensions affected, and that was really surprising. It was multi-domain impairment, like early dementia of Alzheimer's type. We know that there's an association between anosmia and neurodegenerative diseases such Parkinson's and Alzheimer's, and we knew that was important to pay attention to this possibility in the patients that had COVID, because the smell dysfunction was normal symptom in these patients. They were a strong association between anosmia, and it was significantly associated, anosmia and the cognitive dysfunction in this population, and also the result of PCR, if they were positive or not, for COVID, associated with the age of the people, was a good predictor. But was interesting. It was that anosmia predicted the severity of the cognitive dysfunction, and the severity of illness, the severity of the COVID, if they had it. It cannot predict that, the if you had COVID associated with age, was a good predictor of the presence of cognitive impairment. But statistically, the anosmia predicted the severity of the cognitive dysfunction, but not the severity of the illness itself. We have to make a follow-up to see what happens now. I think is early to speculate how it goes now. We have to know more about the relationship of these findings and the biomarkers that we're going to search in. We're going to make a scan of all the genome of these participants, and we're going to make a big sample. We're going to ask for more participation, and we have to see how links these findings with the biomarkers or imaging changes that we find, we're going to find in these people. I think we're going to see how it goes in the follow-up. We're programming to make a 4-year follow-up and see how many patients recover. We don't know if they will recover of this cognitive impairment or not. We have no story, with COVID. It is so new. So we have to see how many affected patients will recover, how many stay the same, or how many worsen. We don't know that yet.